Did you know that strep throat, a condition most of us think of as a childhood nuisance, can actually lead to serious complications like heart inflammation or kidney disease if left untreated? It's wild how something as common as a sore throat can escalate into something so severe. Welcome back to Reem Healthcast. Today we will talk about strep throat. So, what is strep throat?
Strep throat is a throat infection caused by a specific type of bacteria called Group A streptococcus, or Streptococcus pyogenes. These bacteria are highly contagious and spread through respiratory droplets when an infected person coughs, sneezes, or shares utensils. While it often starts with a sore throat, strep throat can quickly escalate into more serious discomfort, especially without treatment.
So, what are the common symptoms of strep throat?
One of the telltale signs of strep throat is how suddenly the symptoms appear. One day you're fine, the next, your throat feels raw and your whole body aches. You may experience severe sore throat without coughing or sneezing, painful swallowing, red, swollen tonsils, sometimes with white patches or streaks of pus, tiny red spots on the roof of the mouth, fever, usually 38 degrees Celsius or higher, swollen lymph nodes in the neck, headache, body aches, fatigue or malaise, or loss of appetite or nausea, especially in children. Unlike viral throat infections, strep throat usually does not come with a cough, runny nose, or hoarseness. That's one of the ways doctors distinguish it from the common cold.
Exactly. Now, let's talk about how people actually get it.
The bacteria can live in the nose and throat, so it spreads through coughing, sneezing, or touching contaminated surfaces and then touching your face. And sharing food, drinks, or utensils is another big way it spreads. Kids between 5 and 15 years old are especially at risk because they're in close contact with each other all day at school. But adults who work in healthcare or have weakened immune systems are also more vulnerable.
And what about strep throat in pregnant individuals?
For pregnant individuals, they're not necessarily more likely to get strep throat, but if they do, it's important to treat it promptly. There are antibiotics that are safe to use during pregnancy, so there's no reason to delay treatment.
And what about infants and toddlers?
Strep throat is pretty rare in babies under a year old, but when it does happen, the symptoms can be less obvious. They might just seem irritable, have a low-grade fever, or refuse to eat. It's definitely a case where you'd want a doctor to evaluate them.
Is strep throat contagious?
Strep throat is highly contagious. You can actually spread it before you even know you're sick, which makes it tricky to contain. In schools, offices, or households, it can spread like wildfire. That's why timing is so important. Without antibiotics, you're contagious for about 2 to 5 days. But once you start antibiotics, the risk of spreading it drops significantly after just 24 hours. And there are some simple ways to reduce the risk of transmission. Avoid close contact with infected people, wash your hands frequently, don't share personal items like drinks or utensils, and cover your mouth and nose when sneezing or coughing. It's also worth noting that some people can be strep carriers. They have the bacteria in their throat but don't show symptoms. They can still spread it, though, which is why good hygiene is key.
Definitely. Now, let's talk about how long strep throat lasts.
With treatment, most people start feeling better within 24 to 48 hours, and the infection usually clears up in 7 to 10 days. Without treatment, though, it can linger for up to 12 days and comes with a higher risk of complications. And those complications aren't minor. Untreated strep throat can lead to rheumatic fever, which affects the heart and joints, or post-streptococcal glomerulonephritis, which is a kidney issue. You could also end up with abscesses around the tonsils or even scarlet fever. These complications are rare, but they highlight why timely treatment is so important.
And how is strep throat diagnosed?
It usually starts with a throat examination. The doctor will look for redness, swelling, or pus on the tonsils. Then, there's the rapid strep test, which involves swabbing the back of your throat. The results come back in about 10 to 15 minutes. Or the doctor might send the swab to a lab for a throat culture. That takes about 48 hours but is more accurate. Once it's confirmed, antibiotics are the go-to treatment. The key is to complete the full course, even if you start feeling better. Stopping antibiotics early can allow the bacteria to come back or even develop resistance. And while antibiotics target the infection, There are also at-home remedies to help with symptoms, like warm saltwater gargles, staying hydrated, and using over-the-counter pain relievers. Rest is also crucial. Your body needs energy to heal. And for temporary relief, throat lozenges or sprays can help, though they're not a substitute for antibiotics.
Now, some people wonder if strep throat can go away on its own.
Technically, yes, it might resolve without treatment, but that's not advisable. The risks of complications and spreading the infection are just too high. So, prevention is key. While there's no vaccine for strep throat, good hygiene practices can go a long way. Wash your hands regularly, avoid close contact with sick individuals, and don't share personal items. And for parents, teaching kids to sneeze or cough into their elbows and keeping commonly touched surfaces clean can make a big difference.
So, when should you see a doctor?
If you have a sore throat that lasts more than 48 hours, a fever over 38.5 degrees Celsius, difficulty swallowing or breathing, or a rash, it's time to get checked out. And if there's no improvement after 2 days of antibiotics, follow up with your doctor. The bottom line is, strep throat is unpleasant but manageable. With proper care, you'll be back to feeling like yourself in no time. And early treatment doesn't just speed up recovery, it also helps prevent complications and protect others. Absolutely. So, if you or your child has a sore throat that feels more intense than usual, don't ignore it. A quick test and some antibiotics can make all the difference. Knowledge really is your best defense.
Couldn't agree more. Well, that's a wrap for today. A big thank you to our listeners for tuning in. We hope this conversation helped you better understand strep throat and how to manage it. Stay tuned for our next episode, where we'll continue bringing you practical, easy to understand health topics. Until then, take care and stay healthy.